It's a pleasure to present this updated systematic review with meta-analysis on female athletes and urinary incontinence according to different intensities of impact. My name is Lourenço. I'm from University of São Paulo in Brazil. It's highly acceptable that strenuous physical activity can lead to pelvic floor disorders and urinary incontinence. However, it's not known yet how the frequent and sustained increase in intra-abdominal pressure can facilitate these disorders. Multiple small impacts may play a different role than a single high impact as a jump. There are some hypotheses whether the muscles in pelvic floor gets fortified or fatigued. The prevalence of urinary incontinence in athletes is variable, depends on the type of physical activity, the intensity, the movements performed, and the ground impact. To start an analysis about this issue, we decided to perform the systematic review of prevalence in urinary incontinence. Our objective is to establish the prevalence of urinary incontinence in athletes and to identify if there's a difference in prevalence of incontinence according to intensity of impact. This is an updated systematic review. Our first study was published in 2018, and due to the great commitment of women to sports and increased data on pelvic floor in this population, there are several new publications on this subject. It's registered in Prospero, and the PRISMA guideline was followed searching the databases PubMed, Cochrane Library, and Lilacs until July 2020 using the mesh terms pelvic floor disorders or urinary incontinence and athletes or sports. We included studies with assessment of urinary incontinence in women as primary or secondary outcomes in all physical activities, professionally or not, at all ages, and the exclusion criteria was pregnancy or up to 1 year postpartum. The meta-analysis was done using the chi-square test. Grundhausen in 1997 developed a graduation for ground impact according to sports movement in different activities. The score accounts for ground reaction for jumps, sprinting, and rotational movements. High impact activities are scored 3, medium impact are scored 2, low impact 1, and no impact 0. According to PRISMA guidelines, our search found 471 studies, but only 40 were eligible for the inclusion. 4 of them are systematic reviews published between 2004 to 2020. The analysis found 9,900 women, being 8,500 physically active and 1,500 controls. We found a similar number for professionals and amateurs. There are 26 sports modalities included, and stress urinary incontinence prevalence varied between 0 for golf to 8% in trampolinists. Age varied between 12 to 71 years and BMI from 13 to 40. There's a preference to include nulliparous athletes in the studies, as there is a great variation in time spent practicing, and smoking was reported in just 7 studies, and use of hormones for contraception or menopause symptoms in just 4 studies. There are 6 studies that compare urinary incontinence in athletes to controls. We found an odds ratio of 2.8 with high heterogeneity among the studies. And the first plot shows it with some studies with a large confidence interval, like Araujo in 2015, with an odds ratio of 16. This is the first plot with the studies that identified stress urinary incontinence in each activity or sports analyzed, according to intensity of impact. It shows a prevalence of 20 for low impact, 33 for medium impact, and 47 for high impact, with an overall prevalence of 38% among all the studies. The same to the control analysis, the funnel plot reveals the high heterogeneity again. Comparing to our previous publication, general prevalence of urinary incontinence in all sports was relatively similar, but there is an increase in studying the high impact sports. However, the increase in the number of participants decreased the prevalence of urinary incontinence in this group. Medium and low impact sports had a slight increase in the population with higher prevalence. This is the first study to consider the intensity of impact in different sports modalities. 2 studies were published before the year 2000, and from 2011 to 2020 there are 24 publications on this subject matter. There's a preference to include high-impact activities and nulliparous athletes in the studies. The assessment of urinary incontinence was always subjective, using questionnaires. Our limitations refer to selection of the populations in the studies in the high difference between the time spent practicing. Also, information not reported in many studies as parity and menopausal status, as pelvic surgery, smoking, and use of hormone limited our analysis. To conclude, there is an increased risk for urinary incontinence in athletes in relation to general population. Ground impact cannot be rejected as a cause of onset or worsening for stress urinary incontinence in athletes. According to intensity, impact may not be harmful as we thought, and risk factors as BMI, parity, and smoking should be included in future studies, as the lack of this information limited our meta-analysis due to high heterogeneity among the studies. I appreciate your attention. Thank you.